I guess one of the aspects that has come up a bit today was about this kind of transdiagnostic approach, that a lot of what has been developed in XR could be applied to different conditions, different populations, different contexts. And so my first question is around that. What do you see as being the kind of opportunities in that, and what are the biggest barriers?
I don't think I'm going to say anything that you all don't know, but yeah, one of the biggest barriers I think is regulation and standardising everything. So yes, that's a big barrier. But there is such wide application because the scope of immersive technology is so wide. It can be applied in so many different sectors. So in education, in the workplace, so like for example menopause and anxiety. So the application is really broad. I'm not sure whether I'm actually answering the question. But yeah, I think there are some common challenges out there. NHS procurement as well. So we see a lot of our projects trying to get clinical validation for the work that they're doing, and the funding only lasts so long, and then when they look at commercialisation they have to go out to other markets as well before they can even get procured by the NHS.
Yeah, thanks, Jay. I guess I come from it very much the same position. I mean, human beings are human beings, okay? We struggle with the same things, get anxious, feel depressed. Some of us might have voices, some of us might have other experiences. So when, for example, from the perspective of avatar therapy, it's come out of the experience of hearing voices, but in the dialogues it's often around anxiety, persons feeling depressed. Social anxiety is massive. I mean, we're kind of socially anxious up here, this is human nature. So I think the real world is telling us that the transdiagnostic applications are important and where we should be going. But these things emerge out of a certain background, and then you get into this terrain where you've got a product and it's for this and it's this intended use, and you've got evidence base for it being for people with this diagnosis of schizophrenia, which is a contested construct, and the real world tells you that people can use this in a different way, and yet if you then adapt in an agile way to what the real world is telling you, you then sort of the game is changing and you haven't got any evidence for that. So the infrastructure around it is not sufficiently agile, and it's regulation, but it's other things that are just the tip of the iceberg really. But I think that's the way forward, and I think actually it's really good to hear that there's a broad agreement that the terrain is not agile enough. We're all part of it, and it needs to change. And I think if that can happen, I think then it can start to transform things, as opposed to we just talk about it being transformative potential. Anyway, I'll stop.
I suppose from a peer perspective, I'm just thinking about how when you're working with social anxiety with VR, and it might be that your clients will have a different diagnosis alongside that, being able to respond as a worker carefully within that situation, as it might be, for example, if someone were to have autism and how that might interact with social anxiety, and how that again would contribute to the psychosis. So understanding the dynamics between those different diagnoses and how you can support effectively is quite complicated, and how that might then interact with the VR in terms of if someone has very specific rules about how they communicate or how they think, and how that might you then have to adapt to using XR within that treatment is something to consider, I think.
Can I briefly add one thing? And I suppose I agree with all of that. I think if we're going to use one approach that's evidence-based in one setting in relationship to another group of people, or people with a different collection of conditions, I just think we have to evaluate that slowly to begin with. I think undertaking a large implementation of just doing works in this group and therefore we'll just use it in this group as well, I don't think that's a terribly responsible way to do things. I think we have to start slow, build up some evidence, and then go from there. So I'm going for a slow, evidence-based approach.
Thank you. Does anyone in the audience have any comments or questions following that?
Hello, yeah, it's on. Well, I think as Alison said, I've been involved in a few projects here, but I think one of the interesting thing is, especially having the demos here, is how you actually explain what XR VR is, because some of it's headsets, some of it's desktop, some of it's how do you explain what it is? And actually that then overlaps into some of the problems about regulatory, because is it a device, is it software only, running on a standard PC, what is it? And I just wonder whether some of the uncertainty of what XR VR actually is might be part of the problem about getting it out there. Because if people don't know what it is, they might worry about that then.
That was a question around the kind of definition of what the intervention, what XR is. So the uncertainty around, is it headset, is it desktop based, and how that feeds into kind of the issues around regulation and aspects like that.
Yeah, in terms of being able to communicate carefully with service users within a mental health team, I think that's definitely a consideration of how you explain what the treatment is and what the function is, and being able to feel that the service user can understand that from initial conversation that you might have with their care coordinator. This is very specific to working within an early intervention team. How then that conversation is then related to the service user, and for that person to feel that it's not far out what the treatment is itself. So, for example, if you were working with a client and the care coordinator had communicated to them what the treatment was, within this instance it'd be game change, the client might experience difficulty with social anxiety but not be confident with that. So the VR itself, when you're trying to say to people, this is a new treatment, it's something that you can, it might be a long-standing issue, you might have stigma around that, but this is a new way to be able to cope with that issue and feel that it's something that you can address in a more, maybe a more interesting or a more sort of modern, more a new way. That's one of the attractions that might come with the VR, but obviously you have to explain that in a sensible and careful way.
Thanks, that's really interesting.
I can imagine talking heads from providers and other ways of telling people what you just said would be really helpful. And just actually saying this is the opportunity for people who don't know very much about it. I'm not sure that's done so well on many platforms. I'm not sure the NHS is doing that so well either, where it's adaptive. So that's some nice things that's really helpful to think about.
I mean, I think it does all come down to education, doesn't it? So, on one of my slides I was saying, immersive technology, what does that mean? And, it's VR, it's AR, it's MR, it's all the Rs, and it can be really quite confusing. So I suppose it all depends on your target audience and just explaining that to them in a way that they're going to understand, which you just articulated, which is really good. But until things become more mainstream, I think we're going to have difficulty. We're always going to have difficulty because, I think it's like 10% of the population is digitally excluded anyway. So one of the things that we try to do within our programmes and competitions is to level up on health inequality. So how do you reach those people that are really hard to reach, especially digitally? I know I'm going off subject, but I think it's an important one. So it's down to education and raising awareness about what technology is out there and what it can do and what it can't do. And I think also reassuring everyone that there are these these safety mechanisms in place, and I think transparency and openness is always key.
Just coming back to one point, I think I take your point, because I was on the train here today. I said yes to come up to Manchester, and I suddenly thought, well, hang on, Avatar Derby's not VR. Am I in the wrong? Am I in the wrong place? But it's a sort of a fluid umbrella term, which I think, as you said, I think it can bring some challenges. But it's also the nature of the beast, because the things change. So Avatar, kind of a couple of years before COVID, was pretty old school network laptops, and then we had to do it in COVID, we had to adapt to do it in a video conferencing, and the next iteration is more of a, it's a different form. So it's quite hard to pin down technologies because they change, they evolve, and I didn't quite catch it. I think in the talk earlier we're starting from kind of the cave type presentation headsets, but then there was remote delivery mobile apps. So it kind of shifts around, doesn't it? And so I think it's an issue, but it feels like it's part of the terrain that it's hard to pin down because it changes. I mean, that's just my thought.
A final thought, it will continue to change. So we haven't mentioned the metaverse, but actually,
Yeah.
it'll change, and all of this will be so much more complicated. I can see Sean from XR Therapeutics looking very excited about that.
I feel like there's lots of parallels in mental health as well in terms of how that's evolved over the years and how our understanding of diagnosis and aspects like that change. Are there any more questions in the audience?
Not really that much of a question, but more just to add to the point that you made, Jane, that in a way the examples really speak, volumes, because then we know, okay, this helped people and did that, and this is why this matters, and then whether it's called this or it's called that, it's sort of secondary, really. So that's just to say that it's amazing that you support projects that can give this expression to those means.
That's an excellent segue on to my next question, which I think there's been some really impressive stories today about how effective XR can be in mental health. And I think, over the day, a lot of people have heard from, incredible people like Toby around the benefits to their lives. And it's much broader than just clinical outcomes at times. So I wonder if you can kind of maybe speak to some of the stories that you've heard that have really kind of given you motivation and hope in this space to kind of invest your time, your energy, resources into it.
I'll start. I'm going to give you a non-health example, bearing in mind I'm a health professional. And I think what we have found is the opportunity to get children into school they can't go to school, or get them to stay in school where they can't stay in school, so they can access the education that everyone else is able to get. And I'm also going to say the same for adults in relationship to adult education and keeping adults in the workplace. So there's a whole load of non-health applicabilities that I think are crucial there. And we have stories from our published research on that.
A confession to make. I've only been working on one set since January, but I have spoken to some of our projects, and they are already delivering impact. One of our projects is working with St George's, and they've co-designed their solution, and it's virtual reality, and it's really helping to calm students that have got anxiety. So that's already delivering an impact, but some of our projects don't have impact for quite a few years to come, and that's something that we have to accept. So it's not just about kind of like the short-term gain, it's the long-term as well. But yeah, no, I'm really looking forward to finding out more about the work of our project. I know XR Therapeutics already, which is great because I work on another programme as well. And that programme actually, I'm going to give it a shout out, it's called the Healthy Ageing Challenge, and one of my favourite case studies there was a lady that was due to have a hospital operation, and she didn't have that operation because one of our projects, Good Boost, that deals with MSK therapies, actually through that programme of activity which is rolled out through leisure centres, she didn't have an operation, which is brilliant from a health economics perspective. So the same will be happening, I know, in Mindset with competition 1, 2 and 3 September, just in case you've got.
In terms of stories and thinking about how VR has been useful, if I was going to say specifically for Game Change and a client that I worked with, in terms of someone being able to go from a space of feeling very maybe introverted to becoming able to speak carefully and socially and be able to become extroverted and feel that they can confidently be themselves. So for game change to take them from a space of feeling that they can't communicate to becoming able to communicate in everyday situations is a really useful way to think of how VR can change someone's life in a small way.
Yes, I mean, it's such a privilege in the avatar therapy to see the change, because you do see it so often. I mean, in the context of the clinical trials, it always gets reduced into a single number, which is either significant or not, and that kind of obfuscates all of the stories that are so important. But to see somebody who is struggling to make eye contact, struggling to talk, first time the avatar puts them down, who can't respond, to then step into their power, stand up, deliver, statements that in our joint supervision, Hannah's here, that actually leave us with a tear in our eyes because it's so moving to see. So many times that we see that, and those things that stay with you. And just as a corollary to that, really, I mean, that's when you go into the real world, that's the change you want to see. But equally, you do have to evidence more than stories. You need to have the stories, but also, so I think one of the things that we're struggling with or thinking about in Avatar is with this real world evidence generation. How do we evidence it sufficiently to kind of meet the requirements, but not lose sight that individual stories are what we're wanting to do here? So yeah, just to put that out as a kind of counterpoint there.
Quick question to the audience. Hands up, whose perception of XR and mental health has improved throughout the day, as you've heard from our speakers? Yeah. And I think that's the power of these stories, is that these have the ability to make us feel so much more enthusiastic about things. So yeah, any thoughts on next steps?
I'd like to see strong integrated data collection from people who are providing treatment via XR. And I would like to see that around effect. I'd like to see it around negative effects, side effects, adverse effects, and I'd like to see it around health economics, which we've not talked about very much.
I think what would be useful to see would be a reduction in stigma, so reduction in how service users might interact with VR, how you're able to work on mental health conditions, and how there's a difference between the way that someone will experience a mental health condition and how that can affect their opinions about themselves, and how stigma about technology can affect the way that service users interact with treatment.
And I think next steps for us really is to make sure that all of our projects deliver a really high return on investment, so that when the next spending review comes, we get another 20 million or more. So yes, it's massively important, because these projects that we're working with, we see as trailblazers. It's really important that the work that they do is really credible and really works for the future of the whole of the sector. So thank you.
I suppose I'd like to see, it was interesting, Jeremy's talks earlier. I think you're a bit further down the pathway in terms of kind of spin up companies and implementation. Speaking from where I'm at the moment, I'm a clinical psychologist by background, and I've got involved in research over the years. And now emerge into a terrain where you're told that the route to implementation, what you want to do, real world impact, involves a commercialisation vehicle. Commercialisation is a kind of a difficult word when you're coming from different backgrounds. So I'd like to see that terrain kind of made clearer to everybody, so that the values that have always been about what everyone's talked about in this room, equity of access, all of these peer workers, service user perspectives front and foremost, that there's a way of implementing that involves these models that doesn't lose sight of that as being a fundamental ethical position. It's tricky from where I'm standing at the moment, because I'm looking forward, but I'd like that sort of, sharing ideas about how you do that in the right way.